Hi, everybody. This is Dr. Paul Feuerstein, editor-in-chief of Dentistry Today. I have a special guest today, Dr. Junyi.
Hi, everyone. Nice to meet
And,
you.
everybody calls you Dr. Junyi, but I'll call you give you your full name is Dr. Junyi Xie. Um, Dr. Junyi is an orthodontist. She practices in Irvine, California. She's board certified orthodontist, and also trained in dentofacial orthopedics, which is, if you don't know what that is, it's treatment of the facial growth of and development of children. And she also treats adults. It's a completely it's a great practice. And the problem is, most of you probably know her because she has thousands and thousands of people watching her on Instagram. You can find it. We'll post it on the screen. Her Instagram is Ortho by Dr. Junyi, and we'll go from there. So today we're going to be talking about Philips Oral Health Care Whitening Portfolio. But before we start, tell us about yourself. Tell us about your practice. Tell us where you are, what's going, what are you doing every day? Where are you right now?
Yeah, so today I'm actually in my private adult room because the sound in here is just a little bit better. I'm at my practice called Kind Smiles Orthodontics and Pediatric Dentistry. It's a dual specialty practice. I'm the orthodontist, and my business partner, Dr. Gary, is the pediatric dentist here, and we are located in Irvine, and we've been open. This was a startup practice, and we've been open for almost 2 years now. And it's just been really, really awesome. We started this practice really wanting to build something that was different. And it was more focused on dental anxiety and having a place where kids and adults can come without being, having the same kind of feelings about dentistry that most people have, which is negative. So we really built this practice to not look, feel, or smell like a traditional dental office. And we, have things like Mochi, which is my dog, but he's our therapy dog in this practice. And you can schedule appointments with Mochi if you have, dental anxiety and things like that.
He's really cute. Well, that's great. And as you were walking through your office before, I was like, wow, this is beautiful. I mean, the glasswork and everything, very, very comfortable looking. So I'm sure you're doing it's just, you're probably getting a lot of people coming in. Plus, again, the Instagram is great because you're just bringing people in. And it's not just about you, it's about teeth and treatment and explanations of things like, what does IPR mean? Things like that. It's really kind of cool. I think it's a great resource for us as dentists, but also for us as dentists to say, well, if you want to know what's going on, sneak over to this Instagram site. So thank you very much for that.
Yeah. Trying to be like transparent on there and
Yeah.
just about the way we practice and how we do things.
It's certainly not commercial. That's the nice thing. It's very, very, friendly and people friendly. So anyway, you're an orthodontist, and people come to you and they say, I want to have beautiful smiles, and you're doing this fabulous orthodontic work. You're highly trained with Invisalign and things like that. But the reason we're talking today is part of the treatment is I'm finished with my braces, and I go, can you make these a little lighter? And so how does that discussion work? I mean, how do you have that discussion? And at what point do you have that discussion? Is it the beginning, middle, end of the treatment?
Yeah, so sometimes patients come in and they're like, just I want, my teeth to look better. And they often ask, in the beginning, like, can I get whitening? And a lot of times they'll even want whitening during their treatment. And typically, there are cases where I will do that during the treatment, but most of the times I like to do it at the end. And it's very easy conversation to have because they come in wanting that, as an orthodontist, even though we treat teeth for not just aesthetics, but most of the people coming in are highly aesthetic conscious. So it's already kind of part of what they're asking for and what they want. So it's very easy at the end of the treatment to just be like, okay, like, here are your retainers. Like, what do you think about whitening? Do we want whitening? And they're like, oh my God, yes, I've been like, I can't, like, I've been waiting to ask you about that. So they're super excited. And it's really just that cherry on top that really just gives them this beautiful smile, even more beautiful than they, have imagined. So it's really.
So there are different systems, but just in general, let's talk to everybody. Let's talk to all the dentists. You're offering the whitening in your office. You may do that as part of your own treatment. There may be a fee for it, but how do you see this as a benefit? I'm a GP, so how do I incorporate whitening in my own practice? And everybody's not looking for white teeth until I ask them about it, or you have to ask first, I suppose. So how do you see this whole thing?
Well, honestly, I think now, I mean, maybe because I live in Southern California, I really think that whitening is like the gateway for a lot of patients to even go to a dentist, right? Like most people these days come in, even for GPs, I've heard plenty of times when they would ask for whitening when they have a deep cleaning or cavities and they don't care about any of that. They're just like, okay, how can I get whitening? So I feel like every office should be offering any kind of whitening service, no matter what you are, whether you're a GP or an orthodontist. I just think prosthodontist, I think maybe even perio, I think every type of dentist office, dental facility should have that available because patients want it. And also it's a great, revenue source. And we got, we're dental professionals. So who would, we're the professionals that can do this safely, predictably, and effectively.
I mean, let's talk a little bit about, so the patients, yeah, I can go down to the store and buy some stuff. And I'll just tell you, my thought is I have to say it slowly, I have a professional product in my hands that's been tested and been shown to be truly effective, not some guy in his backyard making some stuff and saying, here, sell it at some supermarket somewhere. So how do you tell the patients that though, and what words do you use that make more sense than what I just said?
Yeah, I mean, I think there's just so many products out in the market for whitening, for anything. And I think as long as, when you have a patient, you have a personal relationship with them and they have a trust in you. And that's something that they can't get from over the counter because they don't have a trust in other brands and whatever they're getting, they don't know what they're getting. They don't know what kind of ingredients is in it. They don't know how effective it is. They don't know how safe it is. They don't even know if it works. There's plenty of stuff out there that claims that it works and it doesn't. So I think that's where we come in as dental professionals because we are the authority figure on, all things teeth and all things teeth whitening. And if we chose a brand that we trust, then our patients can definitely feel safe using it, knowing that it's going to be safe, it's going to be effective, and overall it's just going to work. And
Yeah, the Philips has a whole array of different products and processes, but this new one, the Philips Sonicare whitening kit, is very interesting to me because it's pretty simple. So the way I see it is it's a little package they get, a couple of trays, and again we talked about that before. You can sort of boil and fit them into there. And there are two different versions of it. There's the advanced version and what they call the caring version. 87% of the patients using it said they had little or no sensitivity, and that's a big deal.
yes, big deal. Yes, I agree. I myself, I get, more sensitivity. So I definitely prefer whitening kits that don't cause sensitivity. Yeah.
And so I guess the difference between the two kits is the slightly difference in peroxide. The caring kit is about 6%. The advanced kit's maybe 9.5%. But either one of them, after a couple of days, they're showing Philips does the research. Even after 2 or 3 days, the patient sees an immediate difference. And then if you push it a little bit, you can go four shades, 5 shades using either of these two products. So I think that's been a great thing. But I love the thing is I still go back to these trays. I think this is the key to this whole thing, that it makes it easier. And again, especially in the orthodontics, if the patient wants to come in earlier before they're finished, they can do that.
Yeah, absolutely. Yeah, so Philips has two kinds of systems. One is the Philips Zoom Lightspeed, and that is an in-office system that they offer, and you can, up to 8 shades whiter in 45 minutes.
Right.
And there's the other option that you just spoke about, the newer option where it's a Philips Sonicare teeth whitening kits to take home, and it comes in the 2 variations, the more gentle prescription and a more stronger prescription, and both actually are very gentle because they're take home but they're just as effective. And so they've just been a great product to have in my inventory to be able to offer to patients who don't have the time to come in office or who may just be a little more sensitive and don't want to, whiten that quickly in 45 minutes. So yeah, it's been great to.
And one of the nice things about your alignment treatments is that you've already proven that the patient is compliant.
Yes.
Because we give as a GP, I'll give them a kit of something, and I come back and say, "Wait, how long did you?" Well, I did it for a day, and then I did it for another day, and so at least you've already pre-trained them with the
Oh yeah.
orthodontics. You got to do this every single day for the course of treatment. I think that's pretty fun. I mean, they have a couple of other products too. They still have their legacy products, which was the day white and the night white, because some people have these trays that they made 10 years ago, and if they were compliant with their retainers, they'll still fit.
Yeah, yeah, exactly.
So I guess the message here is that we are here in the business, and you specifically are in the business of creating beautiful smiles. And you can take the gnarly teeth and make them all straight and white and get the bites correctly and everything else like that. But the finishing touch would be offering the whitening. So just again, let's just talk a little bit about some of the results you've seen from your patients when they come out. And I've seen in your videos, they come and they go, "Look at me, I'm all done, and look at my white smiling teeth and all." So just give me a little bit of background on what you see in your own practice with the combination of ortho and the whitening.
Yeah, I mean, I love analogies. So I'm going to start off with an analogy. Like if you are a home builder and you built a house, you wouldn't sell it to your client without getting it cleaned and nice and polished, right? It's the same thing with orthodontics. As an orthodontist, I work so hard on getting these teeth and the bites and everything to be nice and beautiful at the end. And of course, I would want to present it to them whitened too and cleaned and whitened because that's almost like that's almost necessary, to have your work to be presentable. So it's just been amazing for my patients. They're so happy. I mean, I had one example of a bride and she was like not a fussy bride at all. She just wanted her teeth straightened and I actually wanted to straighten them even more, but she was like, no, I'm actually happy about it. And I was like, okay, well, let's do whitening. She's like, oh my gosh, yeah, like I kind of was thinking about that, and I gave her the Philip whitening kit to take home, and she was just ecstatic. And she, has wedding photos to share with me, and her smile is just amazing. So it makes a huge difference. It's one of those things that you don't even realize you need it until you have, you've done it, and then your teeth just pops, and it's really wonderful.
I have a big question for you.
Yeah.
How do you feel when you see this?
Oh, I mean, this is what it's all about, right? At the end of the day, it's the job that I'm doing. It's so rewarding because of these moments, and it's not in the let's get this tooth exactly, it's when your patients appreciate your work and the whitening just really takes it to a whole nother level.
The bottom line is that the Philips Sonicare Teeth Whitening Kit and the whole portfolio, the Philips Oral Healthcare Whitening portfolio is out there for everybody to use, and it's a trusted brand, and we know it works. They can prove it. You ask to go on their website. They have all sorts of information and articles and studies and things like that. So I guess it's just the bottom line is you want to stick with the good stuff.
Yes.
That's the bottom line.
A trusted brand backed by, research, a brand that your dentist trusts. And yeah, I would say that's the way to go.
Well, Junyi, I gotta say this has been a pleasure meeting you. And like I said, I've spent a lot of time once I met you virtually. I started looking over the Instagram to encourage everybody to see what's going on. And you have a lot of entire nice details, and some of you beaming patients, and you sitting there smiling next to your beaming patients. It's just great. It's a great feeling that you exude this happiness for everybody.
Oh, thank you. We try to do that. Yeah.
Well, thanks everybody. And if you have any questions, you go up to the website. We're going to post the website up over here, and we already gave you the Instagram account number. Or it's not a number; it's the address. And thanks very much.
Thank you guys. Thank you for having me.